One of the biggest dangers of psychiatric medication has nothing to do with the drugs themselves, but in fact how they change the way you see yourself. Because the moment you're told you have an underlying mental illness that you need a pill to fix, it completely changes how you see your symptoms and where they come from. And so in today's video, we're going to talk about the 3 things that people miss once they accept that their symptoms are coming from their brain. And these are how these drugs can reshape your identity and how you see yourself, how side effects from the drugs can be mistaken for new illnesses, and how you're more likely to misunderstand withdrawal symptoms when you're coming off these medications that can leave you trapped in the system forever. And at the end of this video, we're also going to look at how to begin untangling what is really you and what is really your mental illness. And for those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist, and I help people safely taper off psychiatric medications. So let's jump into it. So let's start with the problem of getting a psychiatric diagnosis. Well, typically when you're prescribed medications for depression or anxiety, the doctor will say it's for your underlying condition, with the implication being that there's something fundamentally wrong with your brain or your genetics, and that the way to fix this is through medications. Well, what's the problem with this? Well, the problem is, once you accept the diagnosis, it changes how you see yourself, even if nothing about you has really changed. It's kind of like a Trojan horse entering your mind. Because before, maybe you saw yourself as someone going through a rough time, intuitive, understandable in the context of your life stresses. Or maybe you were just an anxious person at baseline, but you were still managing, still functioning. There was nothing wrong with your temperament. But once you start these medications and you hear the word mental illness, that label starts to take hold, and you're no longer someone struggling temporarily. You're actually someone who's broken. You have a chemical imbalance, and you need meds to function. That one belief that you're mentally ill can quietly shape your entire future. And that's because it can lead to a loss of agency, because the first thing to go is your sense of control. When you start to believe that the problem in your life is biological, you stop looking for solutions. You might have viewed sadness as an effect of loneliness, relationship problems, or difficulty with your work and your career. Something to work on, something to fix, something that you could cultivate through effort and learning. But now, because you have a mental health diagnosis, you start to think, is this just my mental illness showing up again? And you stop asking, what can I change? What can I work on? What can I do? Instead, you might start thinking, this is just how I am. And you accept being tired, unmotivated, or numb as just your baseline. This is my brain. This is my genetics. And you start to rationalize things. This is okay. I have a mental illness. I shouldn't expect to feel well. I shouldn't expect to have energy or feel fully alive. And because of that, you lower your expectations and you're less likely to go out and work on things to actually improve your life. The second major danger is that you begin to misdiagnose side effects as a new illness. And this is so common, because many of these psychiatric medications in some cases can cause serious side effects that look like other psychiatric conditions. Every week I see patients in my practice who have started an antidepressant and they've had a manic reaction and now they think they have bipolar disorder. I see people who get on benzodiazepines to help them sleep and then they become anxious and now they think they have an anxiety disorder. And sometimes people who are on antidepressants long-term, they develop a condition called tardive dysphoria, where over time they start to feel numb, unmotivated, they have some cognitive impairment and high background anxiety, even when there's nothing wrong in their life. And when they look at their lives, they go, what is wrong? My life is fine. I'm not having any problems. But why do I feel so poorly? So unfortunately, because they've been given this mental health diagnosis, they start to think, oh, this is just my mental illness. It's transforming. It's morphing. Mental illnesses are mysterious. Even though I never felt this way before I got on the drugs, maybe my condition is worsening. Maybe I'm treatment resistant. They do not look at the drugs as potentially being the problem. And I have to tell you, many of these medications can make people worse in the long run. And unfortunately, many doctors will miss this because they're not trained to recognize side effects. And because of the pressure to see so many people in short visits, sometimes it's just easier to tell people that the symptoms are due to worsening mental health problems and they could just take another medication or increase the dose. And so instead of pausing to consider the drug's effects, doctors will add another diagnosis, they'll add another med, and there'll be more side effects. And in the worst cases I've seen, people will start medications for a clear life stressor, but over the next several years, they deteriorate, they get labeled with more diagnoses, they end up on 5 or 6 medications. Most of these meds are treating side effects from other meds, and then they'll go on to get things like ketamine, TMS, and eventually ECT, where a lot of this could have been avoided if early on in the process, a doctor simply recognized that the drug was making the patient worse. Now, the third thing that a lot of patients miss once they believe they have a mental illness is that withdrawal symptoms are a sign of their underlying illness returning. Now, a lot of people, they'll get on these medications for a clear life stressor, and then that will resolve. They'll mature, they'll have a better job, they'll be in better relationships, and then they want to come off the medication. But when they make the plan to come off with their doctors, the doctor inevitably tapers them much too quickly, and then they go into withdrawal. Unfortunately, many doctors do not believe psychiatric drug withdrawal is a big deal. They think it's mild and something that goes away in a couple of weeks. And so when patients are having problems that last longer than that, they say, this is just your underlying condition and you need to get back on the medications. Unfortunately, what this leads to is people getting back on the medications and thinking that they're too broken to even come off. The ultimate result of this is someone staying on an unwanted medication for the rest of their life. Now, I want to shift gears for a moment and tell you a little bit about what you should do if you're unsure of where your symptoms are coming from. Because the reality is, many people have been on psychiatric medications for so long that they simply don't know who they are underneath all of the medications. And so this would be a process that I would do if you want to discover who you are underneath all of the meds. So if you're not feeling well to begin with, I would start with lifestyle. Improve your diet, start to walk 5,000 steps a day, remain physically active, and try and get enough sleep. Get rid of harmful substances. Cut out the cannabis, stop drinking alcohol, and cut down on caffeine and nicotine products. Next, you want to look at your relationships. This is one of the biggest things that makes people unhappy. Are you isolated? Are you connected? Are there things that you need to work on with your interpersonal skills? Do you need to see a couples therapist? Building the skills to maintain healthy and mutually satisfying relationships can be a lifelong endeavor. This is not something that just happens like that. Some people, it's very natural. Other people will work on it for a long time. If you need to improve your social skills and things like that, lean into that and build that. Don't just take the excuse of, there's something wrong with me and this doesn't work and it's a mental illness. The next thing to do is to work on your life. Do you feel like your work is meaningful or is it soul-crushing? Do you need a change of careers? Do you need to find some inspiration? Again, finding purpose and meaning in your life can be a lifelong journey. It's not something that just happens, when you leave school and you start college. You might have to go through multiple different things until you find something that's a good fit. Engage in that process. That is what life is about. And finally, you need to get a good physical health checkup. And I'm talking about seeing maybe a functional medicine doctor that you might have to pay out of pocket to see. Because let's face it, the 7-minute visit that you're getting with your family medicine doctor, where they look at their computer the whole time and then they just hand you a statin, isn't going to cut it. You really want someone to dig into the details of your life and make sure that you're not missing any medical problems like gut health issues and micronutrient deficiencies, vitamin deficiencies, things like sleep apnea, things like anemias. You want someone who's really going to take the time to make sure your physical health is in check. And once you have done those things, these are the modifiable things that will make people feel better. They'll have less mental health problems when they do that. After you've done those things, you need to carefully peel off the medications in a way that's not going to trigger withdrawal. And as you do that, you are going to discover how much of your symptoms were, 1, fixed by those modifiable things, and 2, were due to the drugs. And what you'll be left with at the end of it is a clear understanding of who you are and what your baseline is. And so that's it for me today. If this content resonated with you, please consider giving it a like and subscribe. If you'd like more information on how to safely come off your psychiatric medications in detail, you're not going to want to miss this video here, which is the beginner's guide to coming off psychiatric medications.